Vitamins are nutrients that the body needs to work properly, and they are generally classified as either fat-soluble or water-soluble. Vitamin D is a fat-soluble vitamin that has a crucial role in the functioning of human body. Vitamin D deficiency has been identified as a global problem with an estimated 1 billion people worldwide suffering from it. Hello guys, welcome back to yet another episode of Med-Surg Mentor, and today let's see the condition Vitamin D deficiency. First of all, let's see some facts regarding vitamin D. Vitamin D is naturally produced in the human body in the presence of sun's ultraviolet B rays, so it is called the sunshine vitamin. As we already mentioned, vitamin D is a fat-soluble vitamin which has two forms. They are vitamin D2 and vitamin D3. Vitamin D2, also known as ergocalciferol, is derived from plant-based sources such as mushrooms and yeast. At the same time, vitamin D3, also known as cholecalciferol, is an active form that is produced in the skin in response to sun exposure. Important functions of vitamin D are maintenance of bone health, helping in absorbing calcium, preventing tooth decay and loss, regulating the renal functions, protecting body from any infections, helping in cellular growth, repair and metabolism, improving brain functions, reduction in the risk of heart disease, maintenance of healthy body weight, reduction in the incidence of diabetes mellitus, and prevention of respiratory infections. Let's move on to the normal level of vitamin D in the blood. The most accurate way to measure vitamin D in body is 25-hydroxy vitamin D blood test. The normal range of vitamin D is measured as nanogram per milliliter or nanomoles per liter. In severe deficiency, blood values are less than 30 nanomoles per liter or 12 nanograms per milliliter. Insufficiency is defined as 30 to 50 nanomoles per liter or 12 to 20 nanograms per milliliter. 50 to 125 nanomoles per liter or 20 to 50 nanogram per milliliter is the normal or optimal level of vitamin D in blood. Levels of vitamin D higher than 125 nanomoles per liter or 50 nanograms per milliliter is considered as toxic levels. Common causes of vitamin D deficiency are having dark skin, being overweight, having overweight or obesity, not eating much fish or dairy, living far from equator or in the regions with little sunlight year-round, staying or working indoors, working overnight shifts, having chronic kidney disease, liver disease or hyperparathyroidism, having disorders affecting nutrient absorption such as Crohn's disease, having gastric bypass surgery, and using medications such as statins and steroids. Commonly seen clinical features of vitamin D deficiency are frequent illness or infection, fatigue and tiredness, bone and back pain, impaired wound healing, depression, hair loss, muscle pain, anxiety, weight gain, and bone loss. Blood investigations done to rule out vitamin D deficiency are 25-hydroxy vitamin D and 125 dihydroxy vitamin D test. Major complications of vitamin D deficiency are loss of bone density, osteoporosis, bone fracture, depression, type 2 diabetes, heart disease, multiple sclerosis, and cancer. Management of vitamin D deficiency. Vitamin D deficiency can be managed by combination of dietary supplements, sunlight, and administration of supplements. Food sources that are rich in vitamin D are cod liver oil, fatty fishes such as salmon, tuna, and sardines, egg yolk, fortified cereals, oysters, cheese, fortified milk and juices, yogurt, beef liver, salmon, mushrooms, and oranges. Next effective measure to increase the vitamin D level is sunlight exposure. 10 to 15 minutes of sun exposure 2 to 3 times a week to the face, arms, legs and back is needed to absorb a suitable amount of vitamin D. The best time to get the maximum vitamin D is between 10 a.m. and 3 p.m. And people with darker skin may need more time of exposure. Next is vitamin D supplementation. In addition to vitamin D from foods, at minimum, children and adults require a 400 international unit supplement daily, but no more than 1000 international units. Adults over the age of 70 require a minimum of 800 international unit supplement daily, but no more than 2000 international units. Next is the correction of severe vitamin D deficiency. In this condition, a loading dose of vitamin D2 is given at a dose of 50,000 international unit per week for 8 weeks, and then after vitamin D normalization, vitamin D3 supplements are given at a dose of 800 to 1000 international units per day. It can vary based on patient's condition. Next is prevention of vitamin D deficiency. They are eat more foods that contain vitamin D, spend time in sunlight, check the vitamin D levels periodically, take vitamin D supplementation, watch for symptoms, include oranges and cod liver oil in diet, ensure calcium absorption, do regular exercises, and ensure adequate supplements during pregnancy. Nursing diagnosis for patient with vitamin D deficiency. Impaired physical mobility related to bone fracture and pain. Activity intolerance related to weakness. Chronic pain related to bone and muscle inflammation. Disturbed body image related to hair fall. Impaired thermoregulation, hyperthermia related to weakened immune system. Imbalanced nutrition, less than body requirement related to potential fear of weight gain and weakness. And knowledge deficit regarding disease condition. Today we have discussed regarding the condition vitamin D deficiency. This occurs when the level of vitamin D in the body is less than 50 nanomoles per liter or 12 nanograms per milliliter. This plays a major role in the bone health, insulin production, and immune function. Normal level of vitamin D is between 50 to 125 millimole per liter or 20 to 50 nanogram per milliliter. Common clinical features are frequent infections, back pain, tiredness, depression, hair loss, muscle pain, and weight gain. However, Vitamin D deficiency can be managed by administration of vitamin D supplements, dietary intake, and sunlight exposure. Hope this video was informative. If you like this video, give a thumbs up, share with your friends, and make sure to subscribe to my channel. Thank you.